Can I get a facelift and rhinoplasty at the same time? This is a question I often get, and it really begs a bigger question, and that is, what procedures make sense to do simultaneously and what shouldn't be done? Often with surgery, we like to get as many things as we can safely get done in one time because there are advantages. There are monetary advantages. When we do multiple things at once, it costs a little bit less than it does to separately do several procedures. There's another advantage. We get simultaneous healing. So the downtime is less if we do a lot of things together than if we added together the downtime of a facelift and a rhinoplasty and eyelid surgery and other things that we might do. So in reality, there are several components that go into whether or not it makes sense to do multiple procedures. And there are a couple of them where I would say I wouldn't do that. Elucidate each of them. So first of all, it's my feeling that I like to do the procedures that I feel are appropriate for the patient, but assuming that we've identified the procedures, and they may be 3, 4, 5, 6 procedures at once: a chin implant, some liposuction, a lift, eyelid surgery upper, eyelid surgery lower, a brow lift, and maybe even a rhinoplasty. I think I just said 7 or 8 things. I would do them all at the same time. Now, here are the components that go into whether or not that makes sense or it does not. Number one, who's the patient? Is the patient healthy? Can they tolerate a little longer procedure? You need to get a team assembled as a surgeon that will allow you to do safe surgery that lets you get a good result. Having said that, once that occurs, I like to do as many things together, and I often do all of those things that I've just mentioned together. The next thing is, who's the surgeon? So if the surgeon is somebody who is very efficient in the operating room, the procedure can take less time. And if we get the procedures done in less time, it's safer for the patient. They get off the operating table faster, they swell less, etc. I'm a fairly efficient surgeon personally, and so I think that makes a difference in my patients' outcomes. So you have to talk to the doctor as to how long this procedure will take. Even when I do all these things at once, often it does not take me more than 4 hours. And a lot of my multiple procedures take me 2.5 hours. So that's the next thing. Then a patient has to look at costs, and they have to look at whether or not they can afford all the things. Assuming that the cost is not prohibitive, as I mentioned, the cost is always less doing things together when they're clumped together, and this is because the first hour of anesthesia is usually the most expensive, and the first hour in the operating room is usually the most expensive. If we do one surgery, we have only one first hour. And personally, and every surgeon's different, I give a little bit of a volume price reduction when I do multiple things in terms of my fee. So when I look at that, the cost is less. For the patient, their healing time is less than if they do it multiple times. So I tell them all about this, and these are important things. Now, there are a couple of things that I don't like to do together. I usually do not do a subnasal lip lift and a rhinoplasty at the same time. Even though some surgeons do, I do most of my rhinoplasties with an open approach, and that requires a little incision on the columella, and the lip lift requires an incision here. That puts the skin in between at a little bit of vascular risk. So I stage that procedure when they want both, and I do the rhinoplasty during the big procedure, and then I come back, and in the office, I will do a lip lift under local anesthesia. So I look at it as that. So a rhinoplasty procedure, as most of you know, is a procedure where we change the structure to the nose. A facelift does this. The recovery to a facelift might be 10 days. The recovery to a rhinoplasty is relatively the same. If you do them together, the recovery is about 10 days. So I like doing them together because the recovery is nicer and shorter together. So how should I choose a facial plastic surgeon who's going to make a decision to do these? Have a consultation. The consultation is the most important thing. It's like a first date. You want to see if you're comfortable. You want to see if the person seems honest to you. You want to see the patient gets along with the surgeon and the surgeon says reasonable things to the patient. You want to look at the trust on both directions. So I look at all those things, and then you want to decide if what the surgeon describes is what you want. Are they listening to you? If all those things are going well, you've probably chosen a good person. You should choose somebody with experience. Personally, I've done this for 35 years and greater than 20,000 operations. But you want to also ask the surgeon, if you're going to think about multiple procedures, what will be the timing and the time? How often do they do multiple procedures? For me, it's very frequent that I do these multiple procedure operations. If you have questions about this, if you're considering surgery like this, I'd love to help you. Call or email my office today. I'd love to hear from you. I look forward to seeing you in my office. And maybe you'll get a surgery that changes your life.